Hi guys, and welcome back to the body care segment on the Health Monitor show. And before we went on a short break, I did say that I'm with a lovely doctor today in the studio, Dr. Millicent, who is an aesthetic doctor and a dermatologist in training. Behind the scenes, we've been talking and I've gotten to know more about anti-aging and other body safe practices. Well, without saying any more, I would throw you into the spotlight gladly. Hello, thank you so much.
Hi, hello.
Look at you, stunning.
Oh my god,
I'm
gonna get shy.
You're in the beauty world.
Well,
you're repping.
I try my best. Hi, so we're discussing anti-aging and body care today.
Yes, we are.
Okay, I think this is something that we actually should discuss more.
Yes.
I've noticed that most of the conversations that we have in skincare, and it's mostly targeted towards pigmentation, hyperpigmentation, acne, which rightfully so, because it really plagues us as Black people. But I find anti-aging very, very interesting because people shy away from it because of what they've heard or what they think, and I think it's time we set the record straight.
Yes, it's time, because when we were speaking, I kept doing the the bow of shame because the anti-aging for me is like, does it obstruct, or for the ordinary person, does it obstruct the natural course of nature? But before we go into that, what is anti-aging? Let's have proper information of what anti-aging is. Guys, you need to listen. This will help you.
Okay, yeah, I agree. So anti-aging is basically a way that we incorporate products, procedures, lifestyle, even just incorporating things that would help to stop premature aging, right? It's not that you wait till you age and then you start trying to anti-age. That's like you can't reverse aging. Aging is a one-way thing. So anti-aging is basically trying to prevent premature aging, doing things that would support your skin system and help your skin to age more gracefully. Nothing wrong with aging, right? But you can age really nicely. You age like fine wine.
I agree with you, because I feel people have only understood anti-aging from a vanity point and not from a health centered point. Because while we were speaking before we rolled cam, you did mention that our environment plays a huge role on our skin. Right now, there's so many substandard. Our food, the quality of our food has
really reduced.
So your body,
inflation,
exactly, stress. You said something about collagen dipping in your 20s.
Yes, exactly. I don't know if a lot of people know this.
I don't think
so. Men and women are obviously not equal. We are made separately.
Yes.
And for us women, unfortunately or fortunately, once we hit our 20s, by your mid-20s, your level of collagen drops. Now, what is collagen? Collagen is that proteinous substance that helps the skin to maintain its elasticity.
Nice.
It's like the basis by which our skin would form fibrin. All these tissues come together to make the skin very firm and youthful, and to be able to be elastic, to stretch and come back. So collagen is like the bulk of what helps the skin to stay youthful. Now for ladies, this substance that we need starts to drop. Naturally, our body produces it, right? As you're growing up, our body will keep producing it. But for girls, women, once we clock mid-20s, your body's ability to make it starts to decrease. And because of that, you have less and less collagen. And it's like a downward slope. It doesn't just decline and plateau. It keeps declining. Your 20s is lower, 30s even lower, 40s even lower. Meanwhile, for men, they have it better, because their 20s they're good, their 30s sometimes they are good. It's towards their later 30s that they start to lose collagen as well. So
nature is on their side.
Unfortunately, yes. Okay. So we as women, I appreciate that we have to go the extra length to support our skin, to give our skin the care that it needs. So we should incorporate anti-aging, not just because you want to look good, but because you are supporting your skin. Your skin is already doing so much work. I mean, it's the largest organ of the system, the largest organ, and it's very external. So because of that, a lot of external things affect the skin. The sun, for instance, the sun contains UVA, UVB rays. These rays not only darken you, but they also break down collagen. Remember, we're already losing collagen in our 20s. And then you now have the sun breaking it down. You now have stress hormones like cortisol, you know. Things like this will keep depreciating your collagen, so you need to support your body, and that's basically what anti-aging is all about.
So it's not just about wearing shades to cover your eyes, because what's covering your skin? I mean, literally, it's very important.
Yeah.
So what would you say are like, probably, let's compress it, if you were to tell us like 5 major signs of anti-aging? Let's focus more on the brown and dark-skinned people, because I mean, this information is really important to us.
Oh yes,
you know?
yes.
So in men and women, or the signs in men, does it differ with women?
So a lot of things affect the signs of aging, but there are very common ones. Before I dive into it, I need us to understand the skin structure.
Yes.
Right? I think we were mentioning, we were speaking about that, and I told you that's actually what we should pay attention to in choosing products. Now, this skin structure is the component of the different cells that makes up the skin. It's very different in black people and white people and Asians and, you know, different ethnicities. Now, the first sign of aging you're going to notice, the very common one, is you start to see that you have lines. Don't. She's feeling guilty because I gave her a gotcha moment. So, fine lines. Now, fine lines are not necessarily wrinkles, but they are lines that are visible. A lot of people have fine lines. They are like the cousin to wrinkles. So you're not wrinkled yet, but you're almost there.
You are very diplomatic.
I have to be. Now, when it comes to wrinkles, we have 2 types. We have dynamic ones and the static ones. Now, the static wrinkles are the bad guys. The dynamic ones are the ones that are, it's expected because you're not a mannequin. When you make expressions, your face would move. When you smile, your skin would, fold in a certain way, which is why Kim Kardashian does not smile, guys. Now, that is what we call dynamic. So the wrinkle is as a result of a movement. Now, static wrinkles are the ones that are just there. You're not saying anything. You're just, and then you have a line here, or you have some here, or you have here, or if you have any of those lines without any facial expression or movement, that is not great, and you need to get a look into it. So that's like the major sign of aging. But hyperpigmentation can also be a sign of aging.
Do I have hyperpigmentation?
It's called photo damage. Yes. The biggest culprit is, again, the sun. So the sun is doing so much damage to your skin. If you know how much damage the sun does to your skin, you would not step outside of your house without a sunscreen on the exposed areas, not just your face, right? Today we're talking body care. So whatever I'm saying goes for both your face and your body. I know Nigerians would buy all the face serums, but their body is vibes and vibes and inshallah. So please, any exposed area of your skin, if you want to age well, you should always apply sunscreen. So my rule for sunscreen is, when you're going to apply sunscreen for your face, you need at least 2 finger breadths, this line, for your face, right? You apply it all over your face, including your ears and your neck.
Your ears.
Very, very important,
People
if your ears are gonna
ears.
be, if your ears are gonna be visible, you should apply it across your ears, because that sun can picture you, that this is your nice hair. The sun can actually get through it. So then, if you're wearing long sleeve like I am, you don't probably have to apply
Okay.
sunscreen on your arms. But if you're wearing what she's wearing, definitely you should take another finger breath for each arm. Now, this is very important because you don't want to have a face that is nice and youthful and then it's not reflecting on your body. You know, I see a lot of patients, they come in and they're like, they look really good, like they've had fillers, Botox, so their face is very good. And I'm like trying to guess their age. Do you know what I do? I look at their hands.
Their fingers.
I look at their fingers.
Oh.
Because for some reason people don't pay attention to the fingers. And you can.
Yeah.
Just apply your products and just do this. And it's taking care of, but people seem to miss it. So please extend your care to your body as well. Very important. So photo aging can happen from the sun, right? So sunscreen is very important. It's a big sign of aging. And we have what we call sunspots. Some people have like black spots that appear on the face. That's another sign that your skin is aging. Dryness, dehydration, they are two different things, but they can also be a telling sign that your skin is not doing well, right? In as much as your skin produces collagen, it needs something to work with the collagen, right? Can you cook rice without water?
No, you can't.
You can't. So even if you have the rice, you still need water. So hydration also plays a huge role in trying to just keep your skin youthful. And then your lifestyle. We'll get into that soon.
So these are very important tips or signs that we need to look out
Check
for.
out for.
You know, I know mine already.
Done a mini consultation here.
Yes, I know mine already. So I was really shocked, certain things you said, and I want them to also be informed. So real quick, there's certain questions. So they're like general questions people usually ask about anti-aging. I'm just gonna ask, you did mention that aging does affect both men and women.
Yeah.
Yes. So do you think that genetics influences aging?
That's a very interesting question. Genetic influences almost literally everything, right?
Yeah.
So there's a role that genetic plays, and then there's a role that phenotypes, that your environment also plays. So yes, to answer the question directly, yes, genetic plays a huge role in how you age, because it's a lot of sciencey thing. I don't want to get very practical.
But you've given us a very straight.
But if your mom, right, transfers her gene to you, and she has a higher level of elastin, higher level of fiber, denser ones, and she transfers that gene to you, then you would age more gracefully than someone that has less of it in their genetic makeup.
Yeah.
Because this genetic makeup is actually what the products would kind of work on.
Yes.
Right? So if you give it support, just a little support, it will go off. But some other people will struggle because they don't have that kind of genetic makeup. Their elastin fibers cannot be that much, cannot be so dense, and because of it, they would tend to age more than someone that is even like the same age with them. So yes, genetic plays a very huge role.
Very, very concise, very precise, and extremely straightforward. They're very simple to digest,
right?
Also, yes, very simple to digest. So we're going to be asking more questions about aging, but let's lean now towards the part that you represent.
Okay.
In intellect and in looks, beauty.
Oh my God, she is so good at flattering people. I'm gonna be back here. It's just for her to flatter me.
Yes, let's do that. So we're going to go on a quick short break, and when we come back, we're going to enter the world of beauty. Anti-aging, is the main topic of today. Do not go anywhere, guys. This is still the body care segment on Health Monitor. We'll be right back.